Dementia is not a normal part of aging. Rather, it's a term that describes a group of symptoms that interfere with daily life. This complex disorder affects the brain, particularly the frontal cortex, which plays a significant role in our thinking and memory. As we age, our frontal cortex undergoes changes, often requiring additional support to maintain our cognitive abilities. But here's where we need to tread carefully. There's a line that separates normal age-related memory changes from the early signs of dementia. It's easy to dismiss forgetfulness as a part of getting older, but when such lapses start to disrupt our day-to-day, it's a signal we shouldn't ignore. Dementia extends beyond the realm of memory issues and can bring about shifts in personality and social behavior. It's crucial to be proactive and seek evaluation if frequent memory issues disrupt daily life. Early signs of dementia extend beyond memory lapses and may include personality and social changes. In the grand tapestry of life, our personalities and social interactions form the vibrant threads that weave together our individuality. When these threads begin to fray, it might be more than just a sign of aging. It could be an early indicator of dementia. Imagine going to your favorite coffee shop. The barista who you've chatted with for years greets you with a smile, but you can't recall her name. Not just her name, but you struggle to remember the name of the coffee you've ordered every morning for the past decade. This is more than a simple memory lapse. It's a shift in your ability to engage socially, a possible early sign of dementia. Another sign is a change in personality. Consider John, a once jovial and outgoing individual who now finds himself increasingly irritable and withdrawn. His family notices that he no longer enjoys family gatherings or his weekly poker nights with friends. This isn't just John becoming a grump in his old age, it could be a symptom of dementia. These changes can also manifest in more subtle ways. Perhaps you've noticed a loved one becoming more passive or losing interest in their favorite hobbies, or maybe they're showing signs of anxiety or depression. These changes in mood and personality are not just part of getting older, they could be early indicators of dementia. We also need to consider changes in judgment or decision-making. For instance, Mary, who was always careful with money, has started spending recklessly or giving large amounts to telemarketers. This isn't a sudden financial epiphany, it's a significant change in decision-making, another early sign of dementia. In all these scenarios, it's the deviation from the norm that's key. We're not talking about occasional forgetfulness or mood swings, but consistent, noticeable changes in personality, social interactions, and decision-making. Detecting these signs early can lead to more effective management of the condition. Several other medical conditions can mimic dementia symptoms, making it even more important to seek professional evaluation. Now let's dig a bit deeper into these conditions. First on our list is sleep apnea, a common but often undiagnosed condition where breathing stops and starts during sleep. It's not just about snoring or feeling tired. Sleep apnea can actually cause memory problems, confusion, and difficulty concentrating, all of which are similar to the signs of dementia. But the good news, it's treatable, often with lifestyle changes or medical devices. Next up, we have infections. Certain ones, particularly those affecting the brain like meningitis or encephalitis, can result in symptoms akin to dementia. Timely diagnosis and treatment of these infections can often alleviate these symptoms. Then we have brain tumors. These can also present with cognitive changes or memory loss. But with early detection and appropriate treatment, these symptoms can often be managed or even reversed. Moving on to hypothyroidism, an underactive thyroid. This condition can lead to sluggishness, depression, and memory problems. Sound familiar? That's because these symptoms can be easily mistaken for dementia. However, with the right medication to balance thyroid hormones, these symptoms can be mitigated. Lastly, let's talk about medication side effects. Yes, sometimes the very medicines meant to help us can cause problems. Some drugs can affect memory and cognitive function, mimicking signs of dementia. A thorough review of medications with your healthcare provider can identify if this is a factor. So, you see, it's not always as it seems. These conditions can all mimic the symptoms of dementia, but unlike dementia, they are often treatable. That's why it's so crucial to seek a professional evaluation if you or a loved one is experiencing memory issues or cognitive changes. Remember, not all memory loss means dementia. It could be a symptom of another treatable condition. Certain chronic conditions like diabetes can increase the risk of dementia. However, there are modifiable risk factors that can be addressed. When we delve into the risk factors for dementia, it's like piecing together a complex puzzle. Certain pieces are fixed, such as age and genetics. You can't change these. But there are other pieces of the puzzle that you can move, reshape, even remove. These are your modifiable risk factors. Let's start with chronic conditions. Diabetes, high blood pressure, and heart disease can all increase your risk of dementia. These conditions can damage the blood vessels in the brain, impairing its ability to work efficiently. The good news is, managing these conditions through medication and lifestyle changes can help keep your brain healthy. Next, let's talk about lifestyle habits. Smoking, heavy alcohol use, lack of physical activity, and a poor diet can all increase the risk of dementia. These habits can lead to a buildup of harmful substances in the brain and contribute to brain cell damage. Swapping these habits for healthier ones like regular exercise, a balanced diet, quitting smoking, and moderating alcohol intake can make a big difference. Social and mental activities also play a role. Engaging in activities that stimulate the mind and maintaining social connections can help to keep your brain active and resilient. So, pick up a new hobby, join a club, or start a new project. Keep your mind challenged and your social calendar filled. Finally, don't underestimate the power of sleep. Conditions like sleep apnea can not only mimic dementia symptoms but can also increase your risk of developing it. Good sleep hygiene is essential. If you're having trouble sleeping or are feeling excessively tired during the day, seek medical advice. Awareness and management of these risk factors can play a significant role in preventing or delaying the onset of dementia. So it's not just about understanding the risks, but actively taking steps to minimize them. Prevention, as they say, is better than cure. Now let's address some common questions people often have about dementia. The first question many people ask is, can dementia be reversed? Unfortunately, the answer is no. Dementia is typically progressive, meaning it worsens over time. While we can't reverse dementia, treatments can slow its progression and help manage symptoms, which brings us to our next question. How can I support a loved one with dementia? This is a question that tugs at many hearts. The best way to support a loved one with dementia is through understanding, patience, and compassion. Learn about the disease and its effects. Engage them in activities they enjoy and can manage, and ensure their environment is safe and comfortable. Consistent routines can also provide a sense of security. Another question that comes up is, what are the treatment options available for dementia? Currently, there's no cure for most types of dementia, but there are treatments that can help manage symptoms. These may include medications to manage memory symptoms and therapies to help with behavior changes. Non-drug approaches, such as physical activity and social engagement, can also be beneficial. A question often on the minds of those with dementia or their loved ones is, what is the life expectancy after a dementia diagnosis? Life expectancy can vary greatly depending on the type of dementia, the age at diagnosis, and other health conditions. The average life expectancy after diagnosis is about 4 to 10 years, but many people live much longer. And finally, what can be done to prevent dementia? While there's no surefire way to prevent dementia, certain lifestyle changes can reduce the risk. This includes staying mentally and physically active, maintaining a healthy diet, avoiding smoking and excessive alcohol, and managing chronic conditions like diabetes. Understanding dementia is the first step towards managing it. Remember, early detection and intervention can make a significant difference. Consult a healthcare provider if you or a loved one is experiencing memory issues.